Hi, I'm Janine Sorapuru, a junior finance major at Xavier University of Louisiana.
And I am Kerry Morgan, a senior student, sales and marketing major at Xavier University of Louisiana.
And my name is Barakah Hassell. I'm a freshman accounting major at Xavier University of Louisiana.
And so the company's name is Vexia, and today we present to you a form of treatment of diabetic retinopathy in the form of an eye drop. And this eye drop is creating a more easier, efficient way of treating those patients with diabetes.
Currently, type 2 diabetes is on the rise all over the world today. Our goal is to treat diabetic retinopathy in a way that is non-invasive, easy to use, convenient, and less costly. Right now, diabetic retinopathy is only being treated with laser eye surgery and injections.
So we are developing an eye drop to solve the issue of diabetic retinopathy by protecting the retina. The eye drop is a more pleasant and convenient solution and treatment to the disease than a surgery or an injection. And the comfort and convenience that comes with our eye drop form makes it a easier to use and higher quality product.
So, when patients are diagnosed with diabetes, they can sometimes have blood sugar levels that get out of hand. When these levels are out of hand and increase rapidly, this can cause the blood vessels going to the retina to weaken and eventually leaken. The lack of blood vessels sends a signal to the brain to create new blood vessels. When these new blood vessels are created, they are also weak and begin to leak. So this causes patients with diabetic retinopathy to begin to go blind. Our product is going to stop the signals to the brain and help to strengthen the blood vessels in order to help patients to regain their sight.
And our target market includes customers, obviously, patients with diabetic retinopathy, pharmacies and ophthalmologists that often see these types of patients. As well, I wanted to point out that there's 415 people worldwide that have diabetes, and about 90% of those same people are diagnosed with type 2 diabetes. And as my partner previously said before, those types of patients are even at a more higher risk. And that's the main reason why we're here today, is to promote this product to lessen that risk for that type of patient.
So our team has interviewed multiple pharmacists, ophthalmologists, and someone who is affected by diabetic retinopathy. And we have come to the conclusion that not only is diabetic retinopathy an issue, but one that is increasing, and that one is expected to increase in the coming years. And our eye drop is a less invasive and less intimidating form of treatment.
So our goal is to develop an eye drop and begin clinical trials. Those clinical trials will then lead to FDA approval, and that will then allow us to license our IP with a big pharmaceutical company. Once our IP is handed over to that company, that will allow us to take a step back. The pharmaceutical company will handle the marketing and production of the product, and we will continue to collect royalties as long as the eye drops are being sold.
And with our eye drop, our competitive advantage is that we're trying to be that eye drop treatment for diabetic retinopathy that those patients can go to, that those pharmacists can go to, and those ophthalmologists as well. And I also want to point out that there are other scientists out there in the market trying to create treatment for diseases. And we also have a patent already on this, and we're confident that this eye drop today or even tomorrow can go out in the market and make a huge difference in society.
So like my partner Kerry said, our product has already been patented, and we are working towards creating a successful eye drop form. Our next step is to get FDA approval and receive grants from SBIR and NIH grants in the amount of $300,000.
And thank you for hearing us out, and we'll be glad for you to contact us to keep up with the next step. So thank you so much.